Hello, my name is Peter Iorizzo, and today the infection and recovery populations in Heilongjiang Province, China will be analyzed using ordinary differential equations. First, a summary of the research paper will be given. Secondly, the equations and constants used in analysis will be given. Then, the Simulink model will be shown, followed by its results. Afterwards, the results of 3-parameter changes will be analyzed. Lastly, a brief conclusion will be given to outline the major topics covered in the analysis. The research article used in this analysis is Modeling COVID-19 Epidemic in Heilongjiang Province, China by Tingzi Sun and Yang Wang. The article provides multiple coupled ordinary differential equations that represent data collected from January 23rd to March 25th of 2020. The models are accurate to the data and can accurately predict patient populations until April 9th, where it is suspected that an imported escaper patient came into close contact and contributed to a large, unreported asymptomatic patient population. This was determined through stochastic simulations. The authors then urged for stricter intervention to stop the mixing of different patient populations to prevent new infections. Here are the equations and constants used in the research paper's differential equations. Starting with the first equation, S represents the susceptible population, C is the closely monitored population, I is the infected population, R is the recovered population, and A is the asymptomatic population. For the constants, lambda represents the discharge rate from quarantine, beta 1, beta 2, and beta 3 represent the average contact rates between population S and population C, A, or I. Epsilon is the self-recovery rate from asymptomatic patients. V1, V2, and V3 represent the rate of patients transitioning from one population to another. Mu is the maximum average recovery rate, and K and N represent the average capacity of clinics and hospitals and were determined from threshold behaviors. The Simulink model shown is the model used for this analysis. It contains all 5 presented differential equations with their respective constants. A scope is used as shown to illustrate the infected population and recovered population on the same graph. As shown, the result of the Simulink model agrees with the graphs presented in the research article, as they have the same behavior and approach similar values at a given time. The black dots on the research article's graphs represent the actual data, and the brown curve represents the results of the differential equations. Throughout this analysis, the infected population is modeled by the blue curve, and the recovered population is modeled by the orange curve, as indicated by the legend. For this change, the maximum recovery rate was halved. The result is that the infected population has a greater maximum and approaches zero slower than the original in the 62 days. The recovered population has a near zero value for a longer time initially and approaches its maximum value slower than the original. These results agree with the intention of the differential equations and real-world application, where a smaller maximum recovery rate would cause less people to recover in a time interval. This causes the infected population to stay infected longer before recovering, which also allows for the infected population to have more opportunity to spread COVID-19. For this change, the average contact rates were doubled. The result is that the infected population has a drastically larger maximum, which occurs much later in the time interval. The recovered population has a near zero value for a longer time span than the original and fails to reach the same maximum value. These results agree with the intention of the differential equations and real-world application, where the infected population in the 62 days dramatically increases due to greater contact rates, and the recovered population dramatically decreases since an overwhelming infected population would cause health centers to become overburdened. As a result, the total infections would further increase due to a limited availability of medical assistance. For this change, the initial S population was doubled. This produces similar results in the 62 days to the doubling of the average contact rate, where the final infected population is smaller and the final recovered population is larger than the results of the previous parameter change. These results agree with the intention of the differential equations and real-world application in the same manner that the previous alteration does. A larger initial susceptible population poses a greater risk of infection due to more frequent interactions among patients in the same population and others. A greater infected population leads to smaller recovered population due to limited availability of medical assistance. In this analysis, 5 ordinary differential equations that were presented in a research article about COVID-19 patient populations were modeled in Simulink. The Simulink model presented in the analysis was accurate to the graphs and data presented in the research article. Parameters in the Simulink model were then changed to reflect different situations, and the results were accurate to the suspected real-world outcomes of said parameter changes. Here's the citation to the research article used in this analysis. Thank you to all that have listened this far, and have a nice day.